Hey y'all, I'm Karen Mayer Cunningham, the special education boss. If you've ever felt confused, overwhelmed, or just plain frustrated at the 504 IEP table, you are in the right place. Every week, I'm breaking down the rules, the rights, and the realities of special education so you can walk into meetings informed, empowered, and ready to make real change. And whether you're a parent, a teacher, an advocate, a school-based member, or somebody who's just trying to do right by a student, this podcast gives you straight talk, real answers, and tools that you can use immediately. I'm not here to play politics. I'm not here to play sides. I'm here to train people who sit at the table and teach you how to follow the law, ask the right questions, and protect the rights of students. So go ahead and hit subscribe, share this with a friend, and you know what? Meet me back here every single week. We're not just talking about change. We're making it. Because when you know better, you do better. And when we get it right for the child, we get it right for everybody.
Hey guys, we are back. We are in a series related to instructional services under IDEA. If we haven't met, I'm Karen Mayer Cunningham, training everyone that sits at the 504 IEP table to navigate, elevate, and negotiate successful student outcomes. Under related services, that's an additional special education service. So under Child Find, it says that we test children to see if they're in need of special education and related services. Primarily, you need to know you're not going to get the service if you don't do the evaluation. So certainly the evaluation, don't lean into school districts that say, oh, that's embedded. I'm like, make sure that you do this. So the next one we're going to talk about is physical therapy. Physical therapy is a related service. I think this is the most surprising for parents in what it is. We've talked in trainings before. There's three models, right? There's a medical model, there's a therapeutic model, and there's an educational model. They do not play well together, right? But the medical model is going to be pretty quick therapies and rehab and all of that medical model. A therapeutic model might be, oh, you're a private OT, you're a private PT. I want you to come twice a week. We want you to pay us. And there's nothing wrong with paying somebody privately, but it's a totally different model. When we're looking at an educational model, to put something in means we lose time somewhere else. When we put a related service in, they're not saying there till 10 o'clock at night. I've gotten IEPs from parents and they've had more time in related services than in class. And I will reduce those, right? So we're always looking at two things in special education. This should be tattooed on the back of your arm. Meaningful benefit, harmful effect. We can't have everything. You can't eat everything at the buffet 24 hours a day. That would make you sick, right? So physical therapy. So we know what that would be in education. I mean, in medical setting, that is prescribed by a clinician, a medical professional. But we're talking about physical therapy in a school. Remember that we need this service to what? To access the general ed curriculum. When I have kids that have physical therapy, I can probably count on one hand anybody that I would have ever recommended for physical therapy in school, because it's a very different model. And so even for my kiddos that are in a wheelchair, it usually is very light, maybe once a grading period, and they're stretching out on a mat. I'm oversimplifying it. So let's read the statute under the regulation. IDA defines a related service of physical therapy to mean simply services provided by a qualified physical therapist. That's the whole definition. We don't want to overdo it, do we? 300.34. So for children with disabilities, physical therapists can provide a wide variety of services, including focusing on improvement in motor skills, cognitive and sensory processing, integration, balance, muscle strength, coordination, and endurance. So what I usually find for somebody that does physical therapy, whenever they see the kiddo, they might help with positioning. They might help with, if a kiddo kids are growing, right? That, when they get taller, they make sure that their stander is in the right place. They might come in and help with if there are switches attached to their VOCD, if they're using a gait trainer, a walker to make sure that it's the right place, if we're putting mounts on the desk in the class. But there's not a lot of what you would think of in your mind as a physical therapist with somebody on a bed working their muscles. Does that make sense? That's not what occurs in an educational setting. A lot of times I'll have kiddos, the eligibility of Down syndrome. Often those kiddos have low tone and those parents will want physical therapy, but that's not, remember, they would have to be so acute that without this, he can't access the curriculum, right? He doesn't have equal access. So it's a very light service. It usually is integrated with, usually a kiddo has some sort of AT, maybe VI, but it is a related service under IDEA. Physical therapists also might help with really teaching the teacher or the special ed teacher, hey, when he's out here on the playground, you need to do this when he's climbing or swinging or jumping for safety reasons, but it's not a very weighty service under IDEA. Questions about physical therapy? All right, next, psychological services. These are important. 34 CFR 300.34. Any student in a public school can have psychological services. You don't need to be eligible for anything. If you're a student in public school, you can receive psychological services without an eval, without an intake, right? So let's say, heaven forbid, somebody passes away at a school, right? We have teams of people come in, Garrett does this, and their kids will need it longer. There might have been kids that were part of that experience for whatever reason. I was in a meeting in my lovely compliant district. In Texas, we have LSSPs, licensed specialists in school psychology. I said to the principal, we would like the student, while we're doing the evaluation, to have psych services. And she goes, we can't have psych services if he's not eligible for anything. I said, oh, he can. No, he can't. Not in Texas. I just pulled up the state code. So the state code for psychological services, and it literally says for students in school, general ed students, 504 students, or IEP students. And so I sent it in the meeting to the principal, and the principal said, thank you, Karen. And the LSSP said, so it's very important as we sit at the table, any student, if you're serving, if you're on the 504 team, if you're a mama, if you're an advocate, if you're the volleyball coach, any student at any moment can receive the benefit of psych services. Now, psych services with that language, and it moves a little bit, is not required to be attached to an IEP goal. Psych services with that language is not required to be attached to an IEP goal. What is required to be attached to an IEP goal? Counseling as a related service. Counseling as a related service. So when I'm doing a psychological evaluation for any kiddo, I'm going to see if they need psych services and or counseling as a related service, right? So psych services, what is that? That's the LSP or the psychologist or the social worker in Georgia. And she checks in with Mikey, once every 3 weeks. How's it going? Have you karate chopped anybody in our class? Just twice, right? What could you do different? It's more of a check-in, check-out, and they serve the staff as well. Whereas counseling as a related service, which is a one-on-one, very expensive service for the district, because it's just you and Mikey. It's not somebody else. It's not a group, right? Counseling as a related service is a group service, right? And then we can have social skills, which are sort of cousin, or even like pragmatic speech language skills, which are sort of close. Those could be in a group, right? We learn from our friends. But really, when I'm looking at psychological services, I either want psych services, which are still one-on-one, Danette's going to check in with the student, whatever we agree upon, and then give that information to support the staff. Hey, he's having a lot of emotionality when we do this, and she will support the staff as well. Okay. Housing as related service is teaching a child with a disability who has emotionality. I call it HR at work, right? I cannot run out to the minivan and go, Mom, Emma was mean to me, right? I can't. Maybe I can, right? We want kids to, I'm not a fan of the phrase advocate for themselves. That has been perverted in special education. Let me tell you that. We want them to have skills, right? So, my husband goes to work at Amazon. And he comes home and complains to me. I can't fix what happens at work. So we need to teach them that you go to work every day. That is school. So when you're at school, who could you talk to? You could talk to Miss Janet. You could talk to Danette. And she could remind you of your strategies or things that you were working on, right? And so that we transfer those skills, right? Just like somebody taught you algebra, somebody can teach you emotional regulation and wellness. So psychological services under IDEA are defined as service of psychological services to include administering psychological and educational tests or other assessment procedures. But you could be a provider of psychological services and not allowed to test in your state. I'm going to say in a meeting, except in Missouri, are you certified to administer this test, right? Because those are two different wheelhouses. And so a lot of times you'll get these people that do the testing, but they don't do the service. So just know that. They're allowed to interpret assessment results, They're allowed obtaining, integrating, and interpreting information about a child's behavior and conditions related to learning, right, an educational need, consulting with other staff members and planning school programs to meet the special education needs of children, as indicated by psychological tests, interviews, direct observation, and behavioral evaluations. Notice what it didn't say, just evaluations. It didn't say that. Okay. It's so important when you are asking for testing in this area that we say we want psychological testing, we want a consideration of psych testing, psych services, we want counseling as a related service evaluation, we want, where appropriate, a student interviewed, both parents interviewed, and at least 2 teachers. The student interview is gold. And sometimes they're like, well, interviewed Bob, his PE coach. He's doing great. That's right. So what's going on in non-preferred settings? We want that information. And planning and managing a program of psychological services, including psychological counseling for children and parents. Remember, parents are allowed to have that training under IDEA. And assistance in developing positive behavior intervention strategies. The PBIS book, which I think is 300 pages long, it's $5. You can print it out because who doesn't want to print out? You want to make sure that the person working with that student is on board. I've had in the past, not often, but I have had some LSSPs that didn't like providing counseling as a related service. And so I'll just say it's pretty evident that you don't want to do this. So we'll need to get another provider. I asked her if she wanted counseling and she said no. And this student had dysautonomia. He had dysautonomia. So dysautonomia presents as a cardiac condition. It's a cardiac condition that presents as seizures, but it has a psychological impact. So when they have these seizures or these episodic moments, they lose time, usually 3 days back and 3 days forward. I got a child that took the state test and passed it. She didn't know if she took it. So she had this onset dysautonomia. And so I asked for her to counseling as a related service. Why? Well, when you have a seizure in front of 14 people in the cafeteria, it's embarrassing. And when you look completely well, and this is an onset condition, but because of your condition, you now need to ride a sped bus, she needs counseling. And I said, it's part of the law. So if I'm the counselor, when she has flies and go, what are you doing here? I'm just a pretend counselor. I'm sure that's like counseling 101. You seem happy to have the person there, right? Not like, oh. And I had a young lady recently where we had 2 attorneys involved, and she wouldn't turn on her camera. And she goes, I got her this year. I don't even know why she has counseling. They're either amazing or they're the other word, angelic. You got to really listen. And it's very rare. Sometimes you'll be like, why'd you go to counseling school? Did you not know there were going to be people here? And I think some people are really good at doing psychological evaluations, but they don't want to do counseling as a related service. And when you get into schools, you don't get that decision, right? The school assigns you. So sometimes I see people that provide psych services in school that wanted to be like Janet. They wanted to be in private practice, but right? You're at school. So lean into that when you're getting those. So I'm a big proponent of the 5-minute check in and check out once a week for kids that are, junior high or a little higher. 5 minutes on Monday. Stephanie got Eric together Monday this weekend. We send him in with his planner, right? He meets with either maybe the LSSP, the provides psychological services, or a special educator. And then they have 5 minutes to get it together Monday, to get their work done. And then a 5-minute checkout on Thursday that can be provided under psych services. I really, really like that. It's 10 minutes a week. Get in and get out. It is probably the easiest service that our parents are talked out of. Oh, if anything comes up, she can go see Miss Christina. He loves her. Loving somebody in the building is not teaching you a skill. And the counselor is not a person providing psychological services. They're the person helping you pick out 4 maths, 4 Englishes, 4 science, and 4 social studies. They might be the nicest lady or the nicest man, but, she can just see the school counselor. Oh, the one that has Baylor and San Francisco and UCLA and little banners in her room. Yes. Oh, and she has snacks. All right. So make sure that you get this right. It's an amazing product when delivered correctly. The most underserved need in special education are your emotional needs. Everybody on the planet has emotional needs. None of us walk through this life unscathed. And with so many things happen in families, and 88% of families with a child with disability get divorced, and a new parent or grandma now lives with you in the living room. So it's irresponsible for us not to lean into that. But it's the one thing that people will go in a meeting when I'm asking you for testing. Why would you want? It's like I've offended them. Why would you want a psychological They make it sound like you're Jack Nicholson at The Shining, because we all have emotions. And remember, everything in the world comes on a continuum. I am not in the 100th percentile of language and the 100th percentile of academics and the 100th percentile and nobody is. Everything's on a continuum. So we're looking to see if the child is in the norm and the average range of expected physical abilities, of expected verbal abilities, of expected language abilities, of expected emotional abilities, right? And so when I'm explaining this to a parent and they do have an eligibility or they do need process-related service, I would just say, it just means that her emotions are not calibrated at this time. If a bunch of us went out to dinner with the girlfriends and nobody would say, I can't believe you have a prescription for an antidepressant. I'm married. Oh, that came with the wedding. But for some reason, because it's a child, we're like, what? We are in this little flawed world in these little flawed zip-up bodysuits. So please make sure that you get it on initial testing. And at any time, you can ask for this testing. One of the great things of just about asking for psych services immediately is that person can give the evaluator. So there's an OSEP letter in 1990 about it. So whether you participate in athletics or is included in a student's IHP can be critical in determining whether the student may participate. If included in the student's IEP, otherwise applicable or time-limiting rules can bar participation. So it kind of runs into PE. So also have a related service in APE, adaptive physical education. That's different. That is for kiddos that their physical education skills are not in the normed and average range. Can I kick a ball? Can I catch a ball? Can I roll a ball? Right? So recreation as a related service, adaptive physical education are two different things, but they would both be attached to IEP goals. APE is going to usually be weekly. It's going to be in tandem with the PE teacher as well. So related services are a federal requirement. The types are not. So we could have cow gathering as a related service in Texas, but they don't have to have it in Connecticut. So we can make swimming a related service, but it has to be needed for the child to access their curriculum. But adaptive PE is not in Kentucky. We don't have dyslexia in Washington or Georgia we don't even have dyslexia. So there's that. And next, school health services and school nurse services. Two totally different things. Be very clear on the schedule of services page. Every student assumptively has access to a full day of school health services. So that is not something that you need to put in the document. If Haida is teaching somebody and she, cuts her finger, she gets to go down to the nurse and get a Band-Aid. We don't have to go, not your IEP. So those are health services. So it is assumptive under the law that every student has access to the nurse during the instructional day. Okay. If your child has, I have kiddos that have conditions where they can't get too hot, like their temperature has to stay in a certain range. And then I have kids that need school nurse services. So what are school nurse services? So those are services that can only be provided by a school nurse, a CNA, an assistant. There are lots of things that happen with kids in school that you would think have to be provided by a nurse, even to the level of changing out an actual G tube. So I couldn't do that. I would pass out, right? But another staff member can be trained in that. Any staff member can be trained in administering an emergency EpiPen, right? So when you have a child, if they need an IHP, make sure you put that in the plan. Does he have an IHP? An IHP is when something medical occurs at school. Something medical occurs at school. So I'm going to say, hey, Elena, does your son in the meeting, I'm going to say, is your child dispense medicine at home? Yes, we want that information so we know what they come to school with. Is he dispense medicine at school? No. Does he have any medicine that he has to have at school if there's an emergency? Is he allergic to tree nuts, which I didn't know there's. Had a client who wanted, she ended up pulling her kid from school. She goes, I don't want anybody to ever have eaten nuts that are in the class with my son for the whole year. I said, we can't boil the children when they come in. So they're very serious allergies, very serious conditions. She wanted every student in the classroom to agree that they don't eat nuts any day of the week during the instructional year because the nut powder could be on their jacket. Which I said, well, then public school is not a setting for you. It's just unsafe, right? Okay. So school health services just occur. If there's specificity, you got to put that in the document. School nursing services are services that need to be done during the instructional day by the nurse. So I would have two things. I would have an IHP, individualized healthcare plan, and then I would also have a PCS, a personal care supplement, right? So based upon this and these settings and their disability, they need these personal care service minutes. Now there is nursing. You're going to have students who have a nurse. Pretty high percentage of my kids have a nurse. In some school districts, we had a school district around here one year decided nobody can have their own private nurse. Well, if you have a child that has a nurse, you want your own private nurse, right? There are children that need a nurse because the level of their medical care is more than could be supported by the school nurse. So the spectrum, I had a kiddo that when he had diabetes and he went to the nurse 8 times a day, right? So that would be for oxygen, for feeding, specific feeding along with other medical needs, administering medications throughout the day, taking their levels. These people would have nursing at home too. It wouldn't be like, I just like them to have a nurse when he comes to school. And they're going to have nursing on the weekends. They're going to have so many hours. Ultimately, if the parent wants their own nurse there, that's what you need to advocate for. That's what the student knows and that's who they're going to be comfortable with. And there are kids that have nursing that don't end up staying at school. It just makes them too compromised. So, but you are going to have kids that have nurses. You can still come to school. And just because your child has a nurse doesn't mean that he needs to be homebound. Don't go down that rabbit trail. So nursing under IDEA are health services that are designed to enable a child with a disability to receive a FAPE as described in the child's IEP. School nurse services are services provided by a qualified school nurse. School health services may be provided by either a qualified school nurse or other qualified persons. You know, mamas and daddies that have kids with nursing are very on top of it. So that just needs to be laid out in the IEP document. Questions about the difference between nursing, school nurse, your own nurse. The school can provide you a private nurse if you don't have one and the student needs it. Just a couple of things about nurses, but also nurses over time have got us in trouble, right? The nurse is not there to write down that Nicholas didn't get reading and Nicholas didn't get to go to the playground. Although we love that, I cannot bring that up in an IEP meeting. That would be inappropriate. Additionally, if Jahida's really busy teaching and the nurse is like, oh, well, Billy's laying down right now, I can help with the other kids. No. We don't do that. We don't do that. A nurse provides no academic, behavioral, IEPs, education, anything. Here's the thing with the nurse. They're the last people in the building that still have a file cabinet. They have your stuff in a file cabinet. So when your child has nursing or nurse services, they got to be at the IEP meeting. Shocking, right? And then we need a copy of an IHP to be attached to the IEP, right? But you moved cubes. You went all the way, right? So it's important that I articulate that. We talked about this in the mastermind. That's one of those things that I repopulate in class because 7 teachers don't know what the nurse has in her file cabinet. And that nurse might be helping 700 other kids that day, right? So I certainly make sure that the staff knows that every year and they have a copy of his IHP. So now we're going to move on to the last one, not the last one, but the last one. And it's social work services in school. Something also that we don't have in Texas. So in Texas, if social workers involved, somebody's going to jail. It's not a good thing, right? But some states, a lot of states do have social work services. I call them wraparound services. It's a great benefit. They don't usually say much in an IEP meeting, which I think is interesting. They're not necessarily tied to a IEP goal, but they're tied to an identified need. It could be, but they are for IDEA-related kinds of related services. Social work as social work services in schools. So preparing a social or developmental history of a child with disability, group or individual counseling with the child and family, working in partnership with parents and others on those problems in a child's living situation, home, school, community that affects the child's adjustment in school, mobilizing school and community resources to enable a child to learn as effectively as possible in his or her educational program, assisting in developing positive behavioral intervention strategies. So they're really a great professional support when we have them and it works. I have kiddos that have psychiatric breaks throughout the school year. They have psychiatric breaks that please take them to the hospital. They're in intake or inpatient treatment for 7 days, 47 days, right? When we have social work services, that really helps bridge that. We were at Shiloh, now we're back to, Elgin ISD. We don't have that because why would we do that? It's a great service. They help with the depth and breadth. And these were from the new regulations in 2006, facilitating social emotional learning, functioning as an integrated members of pre-referral teams that deliver intervention to decrease the number of referrals to special education, addressing the relevant history and current functionings of an individual within his environment and context, finding, presumably, in addition to mobilizing resources at home, school, and community. So it really is this outreach and reach. It's one of the things that Florida does well. They do that well. They do headbands with ears on them well. And so at the states that have it, I love it. It really is. It's one more support for the kiddo. And when you have kids that are in foster care, that have surrogate parents, that have guardians, that's to be really helpful. So, but I don't find that they're attached to an IEP goal, but they're a great resource for the student, the parents, the grandparents, whoever's involved. So that's going to conclude the 17-week or however many weeks we did the series on related services under IDEA. So I am going to
hit subscribe, share this with a friend, and you know what? Meet me back here every single week. We're not just talking about change, we're making it. Because when you know better, you do better. And when we get it right for the child, we get it right for everybody.